Okay, this lecture is about hypercoagulability, increased tendency for the blood to clot, and how to prevent it so you can keep your arteries open. And it's going to start off with a little bit of a medical joke with the idea of how does one get to the point of what really matters. Okay, well, first of all, blood clots are the most common cause of death. People seldom die because they bleed to death. That hardly ever happens. They die because they clot off an artery. They clot off an artery in the heart, myocardial infarction. In the brain, that's a stroke. And blood vessels are clotting off in smaller locations in little parts at a time all over the body, and those are a major cause of aging. And this is all going to be pretty easy to prevent once you have an understanding of what's going on. And here's what is the joke. If you just go on the internet and type in hypercoagulability to one of these medical lecture sites where they train young physicians, and you will see the hypercoagulability workup. And there will be all this rare stuff. Protein C deficiency, protein S deficiency, all this genetic stuff. Factor V, Leiden factor, prothrombin hyperactivity mutation, G2021-0A, genetic disease, antithrombin deficiency, genetic disease. And yes, if you're dealing with rare, unusual situations when a patient shows up completely unexpected out of the blue with a blood clot, it's good to know about that stuff and do a workup. And it sometimes does turn out to be that stuff. They're all pretty rare. Any doctor will tell you they remember the time when they saw one of these things because it was a rare event. There's also these antiphospholipid antibody syndromes, which are related to lupus. Anticardiolipin antibody, and that's all in the medical books called an idiopathic disease, autoimmune disease. Nobody knows why, supposedly. Okay, then also the patients will often get a cancer workup because cancer will cause blood clots out of nowhere. But in real life, most people with blood clots don't have cancer. Yes, sometimes you need to do that workup in the appropriate setting. Okay, all right. Okay, the next thing is it's important to have a general idea why the patient is likely to form a clot because it guides the workup. When the clot comes out of the blue and no one has any idea why it happened, the patient gets a big, expensive workup. This is just some of the blood tests that are done to work the patient up, and sometimes leg, lower extremity ultrasound, venous Doppler, really decompression ultrasound for DVT, CT chest, pulmonary embolism protocol, CT abdomen, deep vein thrombosis protocol. So this can be very expensive. All right. Now we're going to start getting to more common sense stuff. Virchow's triad, he was a pathologist in the 1800s, and he said, is there a problem with the arterial wall? That increases clotting. Is there a problem with the blood itself? Increased tendency to clot. Is there stasis? For some reason, the patient's not moving around, prolonged car trip, or post-surgical, the patient's just laying in bed. Those will increase the tendency to clot, like after an orthopedic surgery, hip replacement, knee replacement, etc. Okay, diabetes. Diabetes patients are clotting off blood vessels all over the place. The arterial wall endothelial basement membrane is thickened, so that's going to make blood flow more sluggish at the small vessel level, arterioles and capillaries. The endothelial cells are dysfunctional from the hyperlipidemia and hyperglycemia, and that'll lead to increase in the bad stuff, endothelin, which promotes clotting, and a decrease in the good stuff, nitric oxide and prostacyclin, which prevent clotting. And even the platelets are abnormal. They're making less nitric oxide. Lots of bad things happen in diabetes. They tend to have high blood lipids, and eventually they tend to have high blood glucose, hyperglycemia. All of these things are thickening the blood, increasing its tendency to clot. They get kidney damage over time, which starts to impair protein C function, which helps prevent clotting, and because it's impaired, they now get more clotting. Kidney failure patients in general have a lot of problems with forming too many blood clots. Typical diabetic patient, the stereotype is fat, sedentary, meat eater. Okay, we're getting to the best part here. All right, so here's the good stuff, what I consider the good stuff. All that rare stuff we talked about, that's not the most common reason patients have myocardial infarction and stroke. I'm going to get right now to the real good stuff of what you could do. This is how you keep your arteries open. First of all, what makes the blood abnormal? We talked about Virchow's triad. Blood sludge, rouleau formation. Well, gee, that comes from eating a high-fat diet. LDL cholesterol goes up, sticks the RBCs together. Animal protein causes LDL cholesterol to go up. Animal protein sort of puts the body into a synthesis pro-anabolic growth phase, and that'll elevate LDL cholesterol. Stick the red blood cells together, make the blood thick, increase the risk of clotting. So what do you do to avoid that? Just eat a low-fat diet, no meat. Easy. Vasoconstriction and hypertension. So excess dietary sodium is a powerful vasoconstrictor. A meat and processed food diet is going to be deficient in potassium and magnesium, which do the opposite of sodium. They're vasodilators. So what do? Stop eating processed food, no meat, don't add extra salt to your food, or just keep it to a minimum. Once in a special time, you put a little bit on the outside. You don't cook with it. Okay, that's easy to do. Prolonged sedentary. Well, if you have to do a desk job, try to get a standing desk. Try to just stand more, take frequent bathroom breaks. Being hydrated helps. In general, I like being warm for working, but if it's cold in the room, you have to go to the bathroom more often, so maybe that gets you to move more often. Do little things like when the phone rings, stand up when you answer a phone call. Inflammation, generalized inflammation. It increases the tendency of blood to clot because when there's inflammation in the body, the liver is sort of metabolic headquarters central. It'll release what are called acute phase reactants. And one of the acute phase reactants is fibrinogen, which is a clotting factor. It's also called a bridging molecule. It sticks red blood cells together. So anytime you got inflammation in your body, the more inflammation, the worse, the more likely you are to increase your fibrinogen and increase the risk of clotting. That's another reason why you want to just have good overall health habits to prevent inflammation in your body. Okay, what's the main thing that causes inflammation? Eating meat, okay? It's the worst. All right, what else? Take care of your teeth. Leaky gums can be a source of inflammation. Leaky gut. And leaky gut has a lot of causes, anything that disrupts the good bacteria. Because the good bacteria, they take the fiber from plant food and they make short-chain fatty acids. The short-chain fatty acids, especially butyrate, are used by the colonocytes, the lining cells of the colon, to make tight junctions and prevent leaky gut. Okay, other things that will cause leaky gut, we've got whole lectures on this. Antibiotics, excess chlorine in the water, that's why you filter your water. One of the reasons, the herbicides on non-organic food, emulsifiers in processed food, and dietary fat in general. Okay, with meat, you especially are prone to something called postprandial endotoxemia. We talked about that before, where not only do you get leaky gut, but then the gram-negative bacteria associated with the meat release their endotoxins called lipopolysaccharide, which is abbreviated LPS, coming from gram-negative rods, and that can cause clotting in the blood. Then there's a whole theory of dormant bacteria. I'm not going to get into that right now. That's largely the work of Douglas Kell, the PhD guy from England. In the future, I'll talk more about that. But my point, getting back to antiphospholipid antibody syndrome associated with lupus, anti-autoimmune diseases. Well, guess what? They're related to leaky gut. That's the most likely cause, and not just purely idiopathic. And if you avoid leaky gut, you got a good chance to dramatically decrease your risk of that. But Dr. McDougall's got testimonials of patients who reverse that. Okay, xenosylitis. We've had lecture before about that with regard to coming from meat with the sialic acids on the glycocalyx of the cells, the outer cell surface molecules that give a cell its identity, and when they're abnormal, the cell is recognized by your own immune system as being foreign, even though it's not really foreign, and you get this inflammatory response. Where does that come from? From eating meat, especially beef. Okay, prevention. No meat, not one bite. Easy. Oils also cause leaky gut, so no oils, not one drop. No processed food, okay? That's easy to do. Notice how none of this stuff is even part of a standard medical student or resident's education or in their textbooks. And this is just common sense stuff. This is pretty easy. You can look this up in 5 seconds. But they don't know it. I didn't know this stuff till, decades after my medical school. All right. Well, over a decade after. I learned this all from reading on my own. Okay, excessive stress is prothrombotic. I'm being chased by a tiger in the dark. If the tiger claws you, you bleed, you got to clot that off. So it's prothrombotic stress, sort of almost like a little bit reminiscent of acute phase reactants from the liver. You get increased fibrinogen, a blood clotting factor, as well as other clotting factors. Factor VIII, that's antihemophilic factor, von Willebrand factor. And you also get activation of your platelets, okay? And that's all bad. And so try to manage your stress. Usually what you do is you just avoid obnoxious people. Some stress you can't avoid, but you just deal with that. Avoid stress equivalents. No caffeine. Try to get your sleep. Sleep deprivation is a stress equivalent. Raises the same hormone. Same with caffeine, catecholamines, epinephrine, norepinephrine, and cortisol. Okay, and so then there's the old quote, above all, love each other deeply, for love covers a multitude of sins. And the point I'm making here, the vegan diet covers a multitude of sins. The more you look at it, the more you find it fixes metabolic problems. It just does. And that reminds me of like when you're a young teenager, young adult, you got something that's upsetting you emotionally. So you talk to your parents, right? And what happens? Your father says something logical, which is true and correct, but it doesn't resolve the problem for you. And then your mother says something, and it's not exactly logical, but she's right, and it emotionally resolves the situation. Love covers a multitude of sins. Vegan diet covers a multitude of health sins. Okay? I like to spoof quotes. That ends up working well. Calcium supplements. We talked about calcium supplements before. Calcium is a clotting factor number 4. So it's thought that when a person takes a calcium supplement, they're at risk for a bolus of calcium entering the blood to potentially make the blood transiently more hyperthrombotic. And then the hypercalcemia is going to disappear later on. So you check the calcium, you're like normal calcium level, but it was transiently hyperthrombotic postprandial immediately after eating it. That's thought to be one of the reasons why the calcium supplements can increase the risk of myocardial infarction and a thrombotic event. Cold weather is prothrombotic. I like to be warm when I'm doing something intellectually challenging. My family makes fun of me a lot and says I'm hypothyroid because I'll try to dress real warm. I'll even put ear protectors on sometimes, as partly because I want it to be silent too when I'm doing challenging work. But I know I can do really good, for me, academic work if I'm warm and I have quiet. So anyways, also you see a lot of old people, they want to retire. They go south for retirement. It keeps the blood thin, lowers blood viscosity. You get better blood flow, better perfusion of your brain, better perfusion of your heart. And if you can't move south, which most of us can't, you can at least dress warm indoors. Try to keep the thermostat warm if your family lets you. And, wear ear protectors, wear a hat, whatever it takes. Also, dehydration. Being dehydrated raises the hematocrit, the amount of red blood cells relative to plasma, because plasma is decreased when you're dehydrated. So try to stay hydrated if you can. That ends up being an issue potentially if you're eating an OMAD diet, the 1 meal a day diet, because you're skipping breakfast. So you can potentially try to drink water, but drinking water has its problems too, because you run into the so-called water paradox, whereby the more you purify it to get all the junk out, the more hypoosmolar it is, and it can cause headaches. It's not good for you to drink really hypoosmolar water unless you eat simultaneously. So it's nice to eat breakfast when you've got time, but you can get away with it if you're doing everything else good. And in general, if you eat plant foods tend to be wet. They tend to have a lot of water in them. That's partly why they're low caloric density in general, especially all your fruits, but your starches also. Look at potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. So anyways, the key point of this lecture was most people with a blood clot or a tendency to clotting, it has nothing to do with all those rare diseases. It's this common stuff right here. And I just thought it was funny that medical students and residents are not educated in this stuff, but it's basic common sense. And once you know a little about nutrition, it's obvious. Minimize dietary fat, dietary sodium, avoid stress equivalents, keep moving, and try to stay warm, you'll be fine. So that's it.